So, Yusuf, thanks for joining me today. It's good to chat to you again, man.
Thanks for having me on.
So, for those who don't know who you are, please let them know who you are.
Sure. So I am one half of PropaneFitness. I set up this as a fitness blog, really just a sounding board for our ideas with my business partner, Jonny, 10 years ago now, 12 years ago. God, that's flown by. So 2008. And at the time, me and Jonny were working in finance. We started to kind of build a bit of momentum just organically from the content that we were putting out. And it got to the point where we quit our full-time jobs and Jonny went full-time propane. I decided, what would be helpful for this fitness business would be going to be a doctor. So I took a little detour, went to med school. I'm now working as a hospital doctor, and that's where we are today.
That is very interesting, and a real doctor, not a kind of a PhD doctor, right?
So apparently, we are the fake doctors. The medical doctors are the fake ones, and PhD. I can't remember why, but there's some like root word of the term where if you have a PhD, that's like the official one, because they all get, the PhD guys get quite snooty about that. So I'll give them that one. But yeah, so PropaneFitness really was initially a way to kind of put our own thoughts on paper, but it was primarily to distill a lot of the bullshit that you get in the fitness industry, a lot of the kind of disparate information and false claims, to try and just provide something that gives people a bit of clarity and a bit of a North Star to gain muscle and lose fat.
Yeah, and I think like I wouldn't necessarily paint you as a doctor, if that makes sense. Like a lot of doctors, I don't know how to really explain, and I'm 100% just generalizing here, but just a bit strange. But I wouldn't see a doctor going to a house party and doing a beer bong, but I could see with enough peer pressure, you'd probably do one. That's
yeah. So that, that's an interesting observation, and I agree. I think this is partly because, and I'm going to get quite esoteric here quite early on in this podcast, but I think there's something that medical school does to you that creates a set of restrictions in your body and in your mind. It really, it's the hardest thing I've ever done, and it really does forge you through and push you to levels beyond that you thought was possible. But you have to pay a price for that. And especially in the UK, where doctors are trained from the age of, say, 16, where they're often pressured by their parents or by societal values, and they get pushed into med school, which is a all-consuming thing. It does, you pay the price, and you end up becoming so usually the selection criteria for people who become doctors are people who have a kind of obsessional streak to them. They may be slightly more on the autism spectrum, but very high functioning. Sorry about that. And I'm just going to put my phone on airplane mode. There we go.
no worries.
But they're quite high functioning people. But only one kind of aspect of their development is heavily focused on. And the social interaction that's done in patient care should be natural and flowing, but it becomes scripted from the way that we're trained. So I would always encourage, if someone is interested in being a doctor, following the American model of doing something with your life before you go into med school allows your character to kind of form itself a little bit more, so you can maintain a semblance of a personality and you don't end up like this kind of beer bong rejecting kind of person that you described there.
Yeah, that's the whole point, just to do something with your life before so that you will take the beer bong. But I think, no, I've actually, I don't know if I've ever come across a doctor. I don't come across many doctors, but in fairness, but I mean, I think I know one friend who's a doctor, maybe two, but they've gone straight into it. So I've never experienced somebody who's done, say, finance. I think that's what you said you've done. And I know you work in the corporate world and then went on to be a doctor, because it's slog. Like, it is very, very long. And I'm sure you're probably not even finished your studies. I'm not sure. But if you want to be specific, pediatric surgeon or whatever. You have to do more studying.
Exactly. It never ends. And this is part of the problem, that this kind of whole thing perpetuates itself. And in a way, this is what the system needs, because as a doctor, you are, especially in a country like the UK, where we're very protocol and guideline based, we are walking algorithms. You know, we are implementers of the guidelines and the protocols, and obviously with some degree of clinical judgment, but we don't want people that are kind of maverick thinkers. We want to be able to take a patient through diagnosis, investigation, treatment, and follow-up. And so as a result, you're kind of funneled into this approach with the way that you think. And that is what makes a good doctor, someone who can implement that well. What it doesn't work so well with is moving out of that career and applying skills that do require more agency and more kind of, I want to say, twisting the rules a bit more. And, you know, that's, as I say, part of the way that the educational system makes as algorithm creators, and it was almost like a learned helplessness that comes out as a result.
Mm. Yeah, it's interesting because, and I don't know if it's just a survivorship bias, but obviously one of the reasons why I wanted to kind of get you on was to talk about how, you know, doctors' views on health and fitness through the lens of somebody who was first a coach and was evidence-based. You associate with yourself with the likes of, you know, Eric Helms and that kind of train of thought, not necessarily just associate yourself with him, but not just coming from, I'm a doctor, I have this authority bias, therefore, you know, this is my view on health and fitness, and not health, maybe health is a bit of a gray area, but say fitness and, you know, weightlifting and diet that pertains to body composition, not diet in terms of, you know, cardiovascular risk or whatever.
Sure.
I think health is quite actually a broad term when I think about it. People think that, and I've experienced this myself as like someone who just kind of looks fit, that people ask me these, you know, questions about, you know, red meat risk and red meat and, you know, processed meat risk with cancer, and, you know, there's epidemiological studies. And in fairness, I do, and just coincidentally study a master's in nutrition, but just because this has happened before I even started studying, it's just people just think that health and, you know, fitness are the same thing, where it's a huge broad spectrum. And I've actually just started a new master's transferred master's this week to more specific in nutrition, because I feel like it's so broad that if I want to have any confidence or knowledge specifically, I have to kind of focus on it because it's so broad. But yeah,
that's awesome, man.
But yeah, so coming back to the idea of doctors and nutrition, what do you learn as a doctor, and was there anything that from your knowledge already from nutrition and just the application of that from coaching thousands of clients with PropaneFitness over the years? I believe you're probably one of the first online coaching businesses that in the UK. What did you learn in terms of nutrition, and then also training at all? I don't know if you learned anything about training, but, you know, exercise. And then were you surprised with anything and were like, wow, that is really like wrong?
Sure. So that's a really interesting point as well. And I also like massive hats off for going and doing the masters in nutrition, because that's no joke doing that. So yeah, the thing that you raised there is that people see health and fitness as the same thing. And it's often a case of like looking at what is the problem I'm looking to solve and who is the right person to solve that problem. And so, yes, like the issue comes out through two main sources. The first one is that people see them as the same thing. And so they will see their doctor for a health or lifestyle type problem, at least more so in the States. Now, the job and the role of a doctor is diagnosis and treatment of pathology, of illness. So really that's where the remit ends, unless you are a specialist in lifestyle or preventative medicine, for example. Whereas a coach or a health coach or a nutritionist or anything in that sphere is not about diagnosis or treatment of illness. It's about taking people from normal to optimal. How can we optimize someone's performance or their health? Now, you do occasionally get professionals from either territory stepping out of their lane. And this is where there's a problem. In the UK, I feel like this happens less from doctors to give out kind of advice outside of their remit. And this is because of the governing bodies, the GMC, for example, because these people are very protective over their registration. They don't want to step outside of their remit and give advice that could open them up to some kind of liability. The problem that I see more frequently is personal trainers giving out medical advice. I retweeted something yesterday of someone that said, if I ever get cancer, I'm going to cure it with CBD and cold showers and fasting. And it's like, but this is kind of the Dunning. I mean, this is like the Dunning-Kruger effect of like people have got a small amount of knowledge and they think that the whole cancer industry is some big shill and that they're hiding the ultimate cure behind the thing. And it's like that. But the reason that these people can say anything is that the friction to just say anything online is very low, and there's no governing body for a PT for them to get struck off from. So you actually see doctors being disproportionately quiet in those kind of situations, and PTs stepping over into the kind of giving medical advice lane as well. This is in the UK. I think in the US we actually have a different dynamic because the whole incentive structure is set up so that doctors are really paid for over investigating people or for basically they've got a lot more freedom with the kind of treatments that they can administer. So you get a lot more kind of quack type people in the States compared to the UK. And it's so fascinating to see the differences in what you can basically go to the States and find a doctor that will give you a specific treatment that you want. You can go out looking for growth hormone and you'll find someone who will be like, yep, I think this is exactly what you need. And it's much more of a consumeristic kind of model of patient interaction.
Yeah, I think, well, the question is, how much do the big pharmas pay you? And do you make more from that than from PropaneFitness? Because we know you're just trying to push medicines on people and that we can't solve it with plant-based diet or whatever.
It's exactly that. Yeah, I've got a mate who's a big pharma and he's just pushing his anti-disease agenda on everyone, and I'm just the mouthpiece for it.
Yeah, I think it's actually kind of funny when you just take a step back and try and think critically when people say that. Do you think that every single person has this, inherent evilness that's a doctor that just doesn't want to tell the truth, and that they're not family people that have kids and wives or mothers, fathers? It's just mad when you think about it.
It'd be so impressive if it was a real conspiracy, like they've managed to pay off everyone to do this. And you're right, like looking at the economics of it, like if the farmer on his tractor actually had like the cure for cancer and he was hiding it, like that, then as soon as one person launches that to market, they're going to clear up. So it logically just doesn't make sense. Like the market forces would eliminate any kind of hidden cures that exist out there.
Yeah, and I think that the whole, on the flip side as well, the whole rhetoric that food is medicine and you can cure food with, you can cure illnesses with food. And I think, to be honest, like we still don't really know a lot about the properties of plant foods and other foods that could have beneficial effects and synergistic effects long term and phytonutrients. But that's more preventative and just best case scenario when you think about just genetics and other lifestyle factors. Medicine is medicine and food is not medicine, and that's the problem where people start thinking, I don't need medicine because I'm going to use this food. I don't know if you've experienced that at all. As a doctor absolutely. Or as a coach.
Yeah, so the big one at the minute is fasting, and I had a chat with someone yesterday who it was off the back of this kind of I'm going to cure my cancer with CBD and fasting in the future. And I think it's people don't distinguish between like yes, there are cellular mechanisms in fasting and in autophagy that are protective of cancer development. But that is totally different to if someone has an active form of cancer and you need to treat it. It's so yeah, like I'm very much a proponent of, manage your risk factors and stay lean, don't smoke, don't drink, eat foods that are protective of, disease development in the future, minimize your risk of metabolic syndrome and cancers. Totally no problem with that. But it's like when that disease progresses into something which is now a medical problem, then yes, continue the preventative stuff, but that person now needs medical treatment.
Yeah, I think fasting is a pretty popular one. I tried to look into it recently, but I think it take a very, very long time to properly understand, autophagy without just saying I read this article and really looking into the research. And it's pretty complex, and I'm sure you've done your fair share of looking into that stuff. But yeah, I can't really comment, or don't really want to comment and say. I think for fat loss, it's a completely different question, but the benefits of autophagy perhaps for health may be there, but I don't know if we have any conclusive answers. But as a doctor, or as a medicine student, when you were a medicine student, and the curriculum maybe most likely is different around the world, but what do you learn around preventative measures in terms of nutrition, or is there anything that you learn in nutrition, or exercise in general, or is it just more about treating diseases?
Yeah, so this was a common claim as I was going through med school. It was in the news, but people were saying doctors only get 90 minutes of nutrition teaching throughout med school or whatever, and that certainly wasn't my experience. But I can only speak for the med school that I went to. In the UK, I do think the curriculum is quite similar across different med schools, but there will be different emphasis depending on the area. And because of a national shortage of GPs, of general practitioners, there is more emphasis placed on preventative medicine, lifestyle medicine, nutrition. There wasn't much about training. So that is that is a big one. But in terms of nutrition, I mean, we had 3 or 4 months of it, and it was very very intensive, looking at kind of the biochemical pathways, and then moving up to the kind of higher and higher levels of how that impacts metabolic syndromes and diabetes and so on. So yes, it theoretically it is there. But I think it doesn't get applied into clinically in a system that's overrun and rushed. And if you have people in a hospital where the whole thing is basically a conveyor belt, and even in general practice, you have 7 minutes with a patient. And so I think the problem really, I see it bottlenecked, not so much by kind of the knowledge of the practitioners that are working with the patients, but it's more about aligning the incentives. And if you have 7 minutes with a patient and they come to you with a problem and they're looking for a pill or a quick solution, it's going to be very difficult to convince that patient in a 7-minute session to consistently eat a calorie deficit for the next 6 months, even though that may well be kind of the best solution for them, and the doctor may know that, but it's like, I've got one piece of advice or one thing to be able to do to this patient before they leave. So I think it's more of a systemic problem, and I'm so glad that the fitness industry has started to become so normalized now, to the point where, like, during lockdown this year, you're seeing, you go out to the park or something and you see someone just doing lunges or yoga or whatever, and a couple of years ago that would be like, oh, look at that weirdo doing that, whereas now it's just completely normalized and expected. And I think the biggest thing in preventative lifestyle medicine is going to come less from doctors' advice or doctors' kind of education with this stuff, and more about a cultural shift of this becoming not just like, oh, there's the gym rats and the gym bunnies over there. It's like, this is just part of being a human. Do you get what I mean?
Yeah, no, I do think it's there's a lot of complexities, and especially with like poorer areas in, you know, certain parts of England that just that are unhealthy, but not just because they're lazy, if you know it, or because they don't want to exercise, but just economic status and just their ability to afford foods and just prepare foods and time, etc. But I think that's a topic for another day. But yeah, what I think would be like really good, and I don't know if I could see this happening, but you'd have these personal trainers who would be trained up, but to a very, very high level, and they could be referred to by a doctor. But I think the barrier for personal trainers is just so low. And I know, because I remember when I started personal training, I'd already had a lot of knowledge. I was doing bodybuilding, etc., but I hadn't got the cert, and I needed to get the insurance thing because I was starting to work in the gym. So I did it. I think it was ISSA, and in 48 hours, I started and finished in 48 hours and got my first. So I mean, I did it online. I
Star student.
I paid like $700 or whatever. In fairness, I knew a lot of the content, but that's how easy I could easily just go into the gym then and start training people. And like, you know, a doctor referring me somebody who's, let's say, more vulnerable, like obese or something like that, you know, yeah, go ahead and start doing clean and jerks or deadlifting your body weight or something, you know, like that would.
This is
that's
the problem,
what I
man.
see. I was in the gym the other day, and I saw a person train just like doing this very like particular isolation work that you'd probably give a bodybuilder who's like, you know, focused on aesthetics, and this like with a woman that's like middle aged, just why are you doing that, you know, and not even doing it properly. So it's just like, it's just guys obviously read Flex magazine, and that's the problem. I think it's just the barrier to entry is too low, and it doesn't seem to be like medical or professional personal trainers. Of course there is, but again, you touched on the point where there's some personal trainers or you know, experts or gurus that, you know, are now kind of like doctors, but functional doctors, where they're giving out information about, you know, medical information almost. You know, they're just short of saying, you know, here's your prescription or use this, and they're kind of seen as, oh, these guys are really knowledgeable because he's not talking about what the other personal trainer is talking about. And that's what something, the more that I've educated myself, the more or the less likely I am to, you know, be very exact with, I know, like, you know, even with the BCAs, like, they're wasting money, throw them in the bin. I think, well, like, thinking critically, maybe there's some use in some cases, and we still probably don't know the full extent of the information. It's context dependent. So I'm not just going to say like this is black and white answer. But you see that a lot of personal trainers, they're very convinced with, you know, or they're very strong-minded with a lot of claims. So where do you feel that the line is between that? Because I know that you're both.
Yeah, that's such a good point as well. And you know, this is difficult because you've got people like you who you've kind of come full circle to being extremely restrained and nuanced in the way that you would talk about something like PCAAs, but it's not very sexy. And the people who shout loudest and seem the most confident about something are the ones that can convince a layman that they somehow have more credibility or more authority. And you're absolutely right. Like I can't even blame personal trainers that give medical advice, because why wouldn't they? There's no incentive structure to stop them from doing so. And so as a result, the incentive then becomes, how can I sound the most convincing, or how can I be the most like clear cut and black and white and everything? And you know, we had a fitness client referred to us who sent us the plan that her previous coach had sent her, and it had prescriptions in it. It was like prescriptions for ephedrine and yohimbine and it was like big doses as well, like stuff that I was like, man, I don't know if I would give that to a horse. So so yeah, like, but then what's to stop them? If he prescribes something and she has a cardiac arrest, there's no recourse. He's not going to get struck off from any kind of professional body. So you're right that this has to be a kind of systemic change. And I am totally, I love your idea of having GP referral specialist personal trainers that work with GP clinics and practices so that there's a continuity of care. Because the problem comes exactly where a patient comes in, they've got 7 minutes with a doctor. Doctor says, you need to lose some weight. I've got 4 more minutes to explain stuff to you. All right, see you later. And the patient just drops off a cliff. So to have some kind of pathway where they can get referred through a nationally sanctioned personal trainer is going to be fantastic. And it avoids that problem that you said of someone's got a group on level 3 online and they are making an overweight woman with thyroid problems do clean and jerk.
Yeah, I think that's the issue. There needs to be like almost like a clinical level of personal trainer. I think I live in Dublin, but in the UK you have STPs, don't you, or Sustainable Transformation Partnerships. If within that in the NHS you had like personal trainers, like GPs, local authorities, personal trainers, doctors, so that it was this like never-ending kind of one or single experience for the patient, rather than them going to just you going here saying the same thing, going here saying the same thing, and it's just in. But I mean that's that's wishful thinking probably.
Well, yeah, it's a shame because it probably won't get funding because of the cycles of elections being so short that nobody's going to fund that if the benefits are seen in 20 years, even though it's like long term, it is like the best health intervention that they could do, pound for pound, isn't it? But instead it's kind of just shuffling things around each election cycle, which is a shame.
Yeah. So I know you said you originally wanted to be a doctor because you thought it would help your PropaneFitness. Was that a bit kind of was that a mistake?
A bit tongue-in-cheek.
Yeah.
Well, yes.
I mean, has it helped? I mean, of course it's going to help. If you want to be if you're a massage therapist, if you go and do a doctorate in physiotherapy, it's probably going to help. But was it necessary?
Yeah, so I actually did a sports massage course as well, and similar kind of curriculum that you look at it and you're like, this is straight out of like some 80s Flex magazine, and they've not updated the information since. But learning on the job with something like massage therapy, just because of being interested in musculoskeletal medicine, but I've not renewed my my membership with that for now, partly because COVID as well. But so was it useful to be a doctor? I think it depends on like the specific career goal. It's not something I'd recommend for everyone, particularly if they're not looking to be a doctor long term. The level, the knowledge upgrade and the kind of contextualizing of the physiology and all the pathophysiology was incredible. Like I just think there's no way without the pressure of med school that I would have forced so much into those 5 years. So I'm very grateful for that, even though it's I think it's aged me by about 20 years, but there we go. I guess the question is, would I do it again? And this kind of, that's a hard one, because now I'm 30, that's another 5 or 6 years of time. And I think that would be the main thing. Because time always has an opportunity cost, and spending a year doing one thing means that you're stagnating in other dimensions of your life. So only for that reason, but the privilege and the value of turning up and doing the job every day, like that is priceless. And I'm actually really grateful and glad to be able to do the job that I do.
So as a doctor, do you? And I think first of all, just maybe it's just the UK, but doctors are way underpaid. I think I've been following, and I know you guys have had him on the podcast, Ali Abdaal. I've been following him for just when I started studying over a year ago, or doing my master's, I should say, watching his videos on how to kind of study and stuff, and just he obviously explains how much to get paid, and it's just you could make that much working in a supermarket if you worked enough hours, and it's crazy to think how little. But one thing I also noticed was when you had him on his podcast, and no offense to him, I would say this to him as well. It seemed how little he knew about training and nutrition. He just did a few pull-ups every now and then and ate
Oh
takeaways.
yeah. Well, this is it, isn't it? It's like, because medicine is so wide, it's like it's not matched to the epidemiological risk. It's matched
Yeah.
to hospital departments, and so you can take your knowledge as far or as little as you want it to. And so yeah, there are absolutely doctors that have no clue at all about this stuff beyond maybe slightly more than the layman. And this is in terms of application. Like obviously it's funny because like, well, to pass med school, you have to understand the biochemical pathways and the nutrition and endocrine kind of ramifications. But in terms of applying that in the real world, it's that kind of atrophies over time unless you're using it. But the other thing you mentioned about the pay is, yeah, it's absolutely true. I got paid £1,400 last month, and that was like loads of night shifts, like the hours obviously are ridiculous. And you look at the effective hourly rate and you're thinking, yeah, I'd be better off working in Costa. I would have got more sleep and worked fewer hours and earn more money. But yeah, this is maybe one of the other kind of systemic problems, and this mismatch of agendas with funding and so on.
Do you think that might be a reason why, and more so probably, like you said, in the US, maybe the pay is slightly different there, because I know healthcare is private, but that some doctors kind of use that authority to have a very strong stance on health, or a certain way of eating. I don't think much doctors really talk much about training, in fairness, but very, very heavily focused on one specific area, and people do take doctors' words very, very strongly. Even to be honest, I think a lot of times they hold it with higher regard than a dietitian. That's just my kind of experience.
Yeah, dietitians are so knowledgeable as well, and I think if they're often not given the credit that they deserve. You're right. Yeah, I think in the States it's very much leveraged for more for profit, and being able to kind of plug a book or a supplement or a drug that they're pushing. It's funny because with training and talking about training and lifting, the credibility is how you look or which athletes you've produced. So it's quite hard to fake that. And I think you see the occasional doctor who lifts and they're talking about training, and you're like, you know what, fair enough. But you know that most of their knowledge has come from external reading and training themselves. And I think it's kind of why, like, being a personal trainer and being a coach of any sort and being in shape is the biggest thing you can do for your credibility, because you're wearing your marketing on your body, and it instantly, like, especially how the niche that you work in with bodybuilding, you can't fast track your way to a good conditioned symmetrical physique. Like, even with drugs, to have like a bodybuilder style physique, like, it says so much about you as a character, as a person. Like, you have to have years of consistency and everything dialed in, and that doesn't lie. So you're right. Like, you have to kind of, if you walk the walk, and if you have something that's like, you can't shortcut that, it's an instant credibility.
Is that the same in the medical field? I mean, you often hear about a joke of like, oh, the doctor's telling me that I'm obese and he himself is, huge. Is that I guess there's no training on that, but does anybody kind of say, like, give you a nudge here, Yusef, you're an obesity doctor here, but you're kind of, you're in size 42 pants. You need to kind of tighten up a bit.
It's awkward, isn't it? Because we're all, as a culture, we're very restrained of being allowed to say that kind of thing, because it's offensive, and we're all supposed to be body positive and everything. But you're absolutely right. Like, on a very fundamental level, it's not credible if you're telling someone to lose weight or to stop smoking, and you're like outside the hospital smoking yourself. What does that do for your credibility? Like, it's not something that you can get around, or it's kind of the elephant in the room, literally. So yeah, I agree that as a doctor, you're considered the bastion of health to your patients. And while I don't think you need to be Mr. Olympia, you do need to demonstrate some degree of like good health practice. Otherwise, your patients aren't going to take you seriously.
Yeah, no, I've heard that before, like with people that, I guess, if you're giving advice to people and you want them to change, but yet you suffer from the same issue or problem, they just don't feel like what you're saying is going to work, or because they would
It's
imagine
going to
that you.
seem inauthentic, isn't it? I mean, there's exceptions, like having a male gynecologist. Like a male can still be a good gynecologist.
Yeah.
There's no conflict there. But you're right, with obesity or smoking, like these are things that are usually within your control. And yeah.
I don't know why, but people would be happy to call out a personal trainer who's not in shape, who's overweight, and say, he's fat or whatever. How's he telling people to lose weight? But with a doctor, I don't know. Maybe it's because it's more, it's regarded as more professional or something, or I don't
Possibly.
really know.
And I think also like the role, even a lifestyle doctor, like you could argue that yes, they're not as credible because most patients think quite simply and think, well, he's not doing it, so why should I? But at the end of the day, the role of a doctor is to to take a history and examination and direct the course of treatment for that patient. So they're kind of outside of that, like they're not personally involved. Whereas I think a personal trainer, there's a more of an aspirational component to it. Like you're working with a PT and they are the advert for themselves. Whereas the advert for yourself as a doctor is more the letters after your name and the certificates on your wall.
Yeah, and do you find that it's easier to work with people as a coach than it is as a doctor, that both need to make a change? Because I guess with medicine or as a doctor, they come to you because it now has to change. Like it's very serious. Like they don't come to you because they want to lose a bit of weight, because they like to look better, but also improve their health. Like I think doctors that don't necessarily optimize people's health, right? They kind of make sure that they, like you touched on, make sure they don't have any diseases or improving their health from, say,
Absolutely.
beyond neutral.
Yeah, you make sure they're not dying, and in a stress system, you have to send them out the door. So that's an exaggeration, but you get what I mean. And yeah, it's a really important point that there is a big difference between the kind of people that approach you as a coach, because they have put their money where their mouth is. They are coming to you and saying, I want to make this change, and I'm doing everything that I can to make it happen. And when people vote with their money, very different. As a doctor, if you're working in a hospital, especially in a public healthcare system, you've got someone who turns up on your ward. Sometimes they're quite aggressive with you. They don't even want to be seen by you, but they're there because they're unwell and you need to stabilize them. And you kind of have to there are some people who don't want anything to do with you. And it's a very different dynamic that you're having to kind of almost negotiate some kind of agreed plan with them. And so, yeah, you will come across patients that are not motivated to make any lifestyle change. They just want to get out of hospital as soon as possible. Someone who has just had a stroke and you're arguing with them to let them off the ward to go and have a cigarette. But there's a limit to how much you can kind of impose on their lifestyle if they're not also bought into it and looking to change.
I think maybe like as a coach-client relationship, you can kind of quote unquote fire your client and just say get stuffed, but you can't as a doctor be like, okay, shag off, like I'm not treating you. Like what would happen? Or it's like you can go see Jim next door, like deal with him, or whatever.
Just hot potato, you mate at work.
Yeah.
So it can happen occasionally. Like for example, the other day, one of the patients refused to be seen by my black registrar because he was black, and these things can happen in a hospital. And I think you have to deliver the minimum level of care. But if someone is repeatedly being racist and violent and refusing to be treated, I think there is a point where you can say, sorry, but if you're not willing to cooperate here, then we can't just kind of we can't just keep you in.
I guess there's probably a level where it's like leave them out on the trolley in the A&E or driveway, and just they're dying but they don't cooperate, so we're just going to wait till they die, and then we'll bring them in.
And they were shouting like, "Don't call the ambulance! I can't afford it." So yeah, when we've got like this situation where you could end up in an ambulance and then be given a big bill to have to pay the next day.
Hold on, my thing just went. One sec. My speakers, I can't hear you anymore.
Oh no!
Fix this.
How's that?
That's weird. Let me see if this works. There we go. It's better. Can you hear me?
Yeah.
Oh, no, I can't hear you.
It's not coming up from the microphone though. Can you hear me now?
There we go.
There.
Yeah, no, my headphones died, and then I don't know. Anyway, I'll fix
back
that.
in action.
Yeah. Yeah. So if you were from the perspective of, I don't know, we're almost finished, but from a perspective of someone who's professional coach in terms of fitness and aesthetics and preventative health, or detrimental health, or I don't want to call it preventive medicine, but and also as a doctor, what would be the ideal scenario for that somebody sees this professional in this certain scenario? Because I kind of touched on already that when, like, I'm kind of hesitant to answer questions that some clients come to me. Like, for example, recently a client came to me with like serious knee issues, and they hadn't told me before they onboarded, and they said, serious knee issues, and they want me to kind of help them with that, and they need to go, they could barely stand up, they need to see a physio, or have had in the past where it can clearly tell the client needs to see a psychologist or somebody that is there to talk to them, and I felt like I was getting way too pulled in. But when you have these PTs that are offering everything, they're basically, I'm your all for one doctor, GP, physiotherapist, psychotherapist, shrink, whatever you want to call, and also it can help you lose a bit of weight as well if you need that. But I think I'm not going to blame the clients, because it's an issue that's often from our side as a personal trainer. But I've also experienced in the past myself in natural bodybuilding, and as you'll know, because you've been really lean before, you get low testosterone, right? So the very first time I got like really shredded and did my first bodybuilding show, I started getting like depressed at the end. And at 21, I had no idea what was wrong with me. So I went to the doctor because I didn't know what was wrong with me. I just was really low ebb mood. I never suffered from depression. And they got a testosterone test done, because the doctor obviously asked me some questions that would, bring up, low mood, low energy, whatever. And it was really low. So the doctor wanted to give me testosterone gel or whatever that you rub on yourself.
You were like, bro, I'm a natural bodybuilder. I can't be doing that.
I mean, it's when you're 21 and you wanted to be a bodybuilder naturally, and that's what they're telling you. But it was just lucky that I had actually read something from Lane Norton to say that, this happens and it takes about 6 months to recover, that I kind of just left it for a while. I was like, let's leave it for a while. And, naturally it came back when I, ate a few more chocolate bars and got a bit fatter. But now it's a normal physiological thing that happens. And I still experience it to this day when I diet down, but I know that it's going to recover. But I've also, spoke with some clients that have the same issue, that tried to stay way too lean. They were just obsessing about staying lean, and the doctor gave them TRT. And I think just the doctor wasn't aware of you know, what doctor's going to learn about the physiological, you know, changes that occur when you do natural bodybuilding, or when you diet down to single digit body fat, starving yourself. It's just not something that's normal. But they probably would need to see an endocrinologist or a specialist in that area. So what, from what I was saying there, what ideally would you like a client, and then from a practical application, when someone signs up for you Propane, you don't say, well, yeah, you paid £200 a month now, but you're also going to have to get a GP, psychologist, you know.
Yeah.
Why?
Well, I think you've suggested a really good solution there, which is that we bridge this gap between GPs, who are really the coordinators of care, and can then join up this dot between health and fitness. And as you said, if you have a client that comes to you with a knee issue, the GP is at the coordinator at the center of this kind of circle and says, right, you, based on the presentation, you need to see a physio, or you need to be referred to orthopedics, or you need to have whatever the referral is. And you need, or you've got low testosterone, you need to be referred to X, Y, and Z, or to this PT. Now, the thing that probably does need to be updated with the medical education system, I don't think it necessarily is med school. I think med school would be helpful to have a bit more of that stuff. But I'm always going to say that because of who I am. But med school prepares you for the specialty training. And the majority of specialty training is hospital medicine. And in hospital medicine, there is not really much scope within hematology or renal or dermatology or ophthalmology to be kind of covering this stuff. And obviously, all of those fields are so wide that they need to kind of have some space for their own things. So where this needs to come in is to update GPs in with this new wave of the fact that fitness and fitness practices are changing very quickly, that we're now going to have new waves of people with labrum tears from doing CrossFit with kettlebells, people who are getting stage lean all the time. Like, these are not medical presentations that we're used to having, 20 years ago. But now we're seeing loads of young men at 22, 23 with low testosterone, as you said. And I think being able to train GPs and recognize that these are all sequelae of the fitness wave, and here is how to deal with them, would be really, really valuable.
Yeah, I think, like, if you, I don't know, are you a GP, or what's your kind of role?
So I'm a hospital doctor at the minute. So I'm in my my foundation training. What you do when you finish that is you then start to kind of specialize. So GP is the goal for me.
Yeah, so I mean, if you were, or when you're a GP, if you saw some guy that came into you and it's clear that he lifts weights and was shredded and he had a lot of testosterone, you wouldn't say, well, we need to put you on some tests. You'd say, put it with body fat. But that, you wouldn't have learned that probably from, your doctor or your medical school. You would learn it from your working with clients, the practical application to yourself.
Yeah, I think so. I think most doctors would be able to kind of put that patient through the correct pathway. The only time it starts to become quite specialist is if you've got someone who, in that, you've got that presentation, as you said, someone who's shredded, low testosterone, and they admit that they've previously been on a cycle of steroids or some kind of peptide or whatever. That's like, right. Yeah. So you'd run a hormone panel, and then you'd be like, you know what? I think you need to see an endocrinologist, because it may well be that they've created some degree of shutdown, or they need to restore their Leydig cell function, or whatever it is.
Yeah, this is definitely a topic for another day, or probably never a topic. But just the question that I have is, because I don't really know much about anabolics or whatever, but I do follow like bodybuilders, and I see that it's become more popular to be like transparent online and tell people what you use. And then you have these, like, I won't say self-proclaimed experts, but people that are clearly giving coaching to other people, which half of it's pharmacology. And do endocrinologists, I don't know if you know any endocrinologists, but do they learn a lot about kind of anabolics, and do they stay up to the latest research? And I guess, steroids is probably a lot more popular and used more used more widely than people actually think in your recreational, meatheads. So is that something that they're aware of? And, I think that's something that people don't really want to discuss with the doctor, because they think the doctor's just going to say no,
So I've had some funny experiences with that, where I've maybe been clerking a patient who's been seen by another doctor in the same, within the last hour. And to that other doctor, they may have denied steroid use to them. But then when they speak to me, they admit to it. And I think it's because they can tell that I'm kind of on their level. Like, they can tell that I lift as well. And I'm, just talking through and, okay, what were you doing at the time? Right. You were bench pressing, how much, and have a bit of banter with them about it. And I think they're much more open to that, because they recognize this isn't some like stuffy doctor who's going to judge me for it. At least I like to think that anyway. But to answer your question about like how much do endocrinologists know about this kind of stuff, I did an interview actually recently with a guy called Asif Munaf, who is a sports medicine registrar. Really fascinating. He specializes in performance enhancing drugs and sports medicine, and you're getting more of these popping up in the UK. There's a few major authorities on this in the States that are kind of deep down the rabbit hole of performance enhancers. And I think that's where, because they're used more widely and people are more experimental there, that you're going to have more pockets of expertise. In general, endocrinology is wide field where you will have the majority of whom will be diabetologists. And so they're very good with diabetes management. You will get some hormone specialists, but I think what happens is, as you said, that it's becoming more widespread, and actually the level of experimentation and the new anabolics that people are using, the SARMs, so selective androgen reuptake modulators, and estrogen blockers, and even estrogen receptor destroyers, all of the peptides, pro-hormones, that they're coming out at a rate that the kind of traditional knowledge is not really keeping up with. So as you said, it opens up this hole for kind of bro scientists to start coaching with pharmacology and being a lot more experimental, and they may well be able to get good results with this. But the further down the kind of experimental route that you go, and the more niche kind of stuff that you take, you're starting to then mess with pathways like myostatin and IGF-1 and mTOR and stuff that is like, oh, this is a little bit fringe now, and you're going to have a harder and harder time finding a doctor who's going to be able to help if something goes wrong. And the thing that scares me most about that is contaminants in these substances, or if you take something that's going to really upregulate parts of your pituitary gland and then you can't stop it, you're kind of on your own, because you've gone to a doctor who's like, do you know what, man, like there's hardly any human studies on this, and we don't know what we're playing with. Whereas if someone's just taken straight up testosterone and they've caused themselves some shutdown, most endocrinologists will be able to help with that. So do you see what I'm saying? That like the more kind of off piste that you go, the more on your own you are.
Yeah, I guess because they're going off piste for very very niche reasons, and it's not like that will be covered because it's not something that you would typically see. It's like the 0.1% of people that do this kind of stuff and take the new hormone or the pro hormone that's being slightly chemically altered to make it legal by putting an extra benzene ring or whatever on it, and now it's illegal. But you don't know what the hell is going to happen. You do see that a lot. I guess with drugs, and not drugs, but you see it a lot with recreational party drugs and nootropics and things like that. It's
terrifying. Like what they've done to the, spice, for example, every time they make a modification to it, it has some mad, unpredictable effect, and it's producing what you think would come out of a zombie movie.
I remember the first time I never smoked it, but the first time I experienced that was at 18. I was going to a party, and a mate of mine smoked it, and a few of them had smoked it in a park, and I was the only one out of like 5 that didn't smoke it, and we're supposed to go to this 18th, and he thought that he was a monkey in a cage, and because all the others had smoked it and they were like hallucinating, and it was like 5 o'clock in the day, I was the only one that could go with him to the hospital. So that was my night ruined, sitting in A&E with all these drunk kind of, homeless people and just junkies and stuff. And it was a nightmare. But
what a rubbish evening.
Yeah. But anyway, man, thanks so much for coming on. So where can people find more about you, and what are your plans for the future? Is it to be a full-time doctor? Is it to merge the two together? Is it to write a book about your new experiment or new discovery about this one food?
the one food that doctors don't want you to know about, the goji berry extract. Man, well, thanks very much for having me on. And you can find out more about me on PropaneFitness.com. So that's propane, the gas, not our stance on pain. That's the best place to find kind of the hub of all of the types of information that we have. We're on Instagram, YouTube, and Twitter. My plans for the long term, I'm going to take a break from full-time training in medicine for a couple of years, see where things take me. The plan is to integrate clinical work in some capacity in the long term. I suppose how that manifests is still to be determined.
Yeah, you could be like the English Dr. Spencer Nadolsky, right?
That would be lovely. I'd be happy with that.
He just sits and makes memes, I think, on Instagram all day.
It does seem like it, doesn't it?
But also, you, just to mention as well, you also do, I know there's some coaches and personal trainers that listen to this, you do a propane business as well.
Thank you. Yeah. So Adam's actually had some great success with this too, and I'm really, really pleased to see. We basically set up Propane Fitness and made a lot of mistakes, learned a lot of lessons over the period, and we're able to scale our revenue from kind of capping at about 2K from one-on-one coaching to bringing it up to six figures from the systems that we now teach, basically of leveraged coaching. And it's allowed us to deliver a much better experience for the clients, and to coach many more people and reach more people too. So we now sell advice, or like that, basically using the systems that we've used to grow Propane Fitness for coaches and personal trainers to take their offer online too. So that's on propane-business.com, but you can see the whole thing through our channels as well.
Perfect. All right, man. Thanks so much for coming on again. I'll leave all those links in the show notes, and I'll chat to you soon.
Amazing. Adam, thanks a lot.